You know, we use our hands for absolutely everything. But have you ever stopped to think about what happens when that incredibly complex machine just breaks down? Today, we're going to look at two conditions that do exactly that, but in totally different ways: ape hand and intrinsic plus hand. One is a problem with the wiring, and the other is a problem with the motors. So let's get right into it. I mean, just look at it. The human hand is truly an extraordinary piece of biological engineering. Think about it. From the lightest, most delicate touch to a powerful, crushing grip, our hands perform thousands of tasks every single day, and with a precision that's just mind-boggling. It's this perfect harmony of nerves, muscles, and bones all working together. But what happens when that harmony gets disrupted? What if just one of those tiny components, a single nerve, or one small group of muscles, stops doing its job? Well, the results can be pretty profound, and they can completely change a person's ability to navigate their daily life. So here's our game plan for this explainer. We'll start by appreciating our hand as an everyday marvel. Then we'll introduce our two troubled hands. After that, we'll dive deep into the key difference: nerves versus muscles. Then we'll look at how doctors read the signs, and finally, we'll explore what it takes to start restoring hand function. Okay, let's get introduced to our two subjects. Now, while they both affect the hand, right from the get-go, their names and their definitions give us a clue that they are very, very different problems at their core. So first up, we have ape hand, which is also called simian hand. The number one defining feature here is all about the thumb. It loses its ability to abduct, which is just a fancy way of saying it can't move out and away from the palm. And believe me, this isn't just a cosmetic thing. It basically destroys your ability to grip, well, almost anything. Now, let's switch over to intrinsic plus hand. Just listen to the language here. It's not about one specific movement failing. Instead, it's described as a posture that's caused by a muscle imbalance. And that word imbalance, that is the absolute key to understanding the huge difference between these two conditions. All right, so let's dig into that core difference. Is the problem in the wiring, the electrical system, or is it in the motors themselves? This is the fundamental question that puts ape hand and intrinsic plus hand in completely different categories. With ape hand, the villain of the story is almost always the same character, the median nerve. The easiest way to think about it is like a critical electrical cable that's either been pinched or completely cut. And you can see just how much this one nerve is responsible for. It's like a master conductor for the hand. It doesn't just give you feeling in your thumb and fingers. The most critical part is that it sends the go signal to the thenar muscles. That's that fleshy, meaty part at the base of your thumb. If that signal doesn't get through, you lose opposition, which is that uniquely human ability to touch your thumb to your other fingertips. So what causes this kind of nerve damage? Well, a lot of the time it's something like really severe carpal tunnel syndrome, where that nerve gets squeezed right there in the wrist. Or it could be from some kind of trauma, like a nasty fracture or a dislocation that physically injures the nerve. Okay, now let's completely switch gears and talk about intrinsic plus hand. If ape hand is like a power outage to the thumb, intrinsic plus is more of a mechanical problem. It's like a tug of war where one team is pulling way, way too hard. And here are the two competing teams. On one side, you've got the small, delicate, intrinsic muscles that are actually inside your hand. They handle all the fine-tuned movements. On the other side are the big, powerful extrinsic muscles that are in your forearm, and they control your main grip. With intrinsic plus hand, those little intrinsic muscles become way too tight and spastic, and they just overpower the bigger muscles, pulling the whole hand into this stiff, awkward posture. And in this diagram, you can actually see the muscles we're talking about. These are the intrinsics, the interosseous and lumbricals, and they're tucked way down deep between the bones in your hand. You can see how they attach right to the finger bones. They might look small, but when they get too tight, they exert a ton of force, and they can change the entire shape and function of the hand. So, with such different root causes, you'd expect to see totally different symptoms, right? Absolutely. So let's look at how a doctor can actually read the signs to tell these two apart. The visual clues are pretty striking. For ape hand, it's all about that thumb. It just lies flat against the palm, unable to move away. That muscle at the base can even start to shrink and waste away. But with intrinsic plus, you get this very different signature look. The main knuckles are bent down, but the finger joints are held rigidly straight. This makes it almost impossible to open your hand wide enough to grab something like a can or a glass. And the way they're diagnosed follows that same logic. For ape hand, you've got to check the wiring.
So doctors use tests like nerve conduction studies to see how fast electrical signals are moving down that nerve. For Intrinsic Plus Hand, it's a much more mechanical, hands-on diagnosis. It's usually figured out with a physical exam using specific movements like something called the Bunnell test to check for that signature muscle tightness.
You see, understanding the root cause is everything because it totally dictates the treatment plan. So let's take a look at how different the approaches are for trying to get these hands working again. When you're treating Ape Hand, the entire focus is on that damaged median nerve. If it's a mild case, you might start conservatively with things like splints and therapy. But if the damage is more severe, surgery is often the best bet. That could be something as simple as releasing pressure on the nerve, or it could be a really complex procedure like a tendon transfer, where they actually reroute a healthy tendon to do the job of a muscle that's been paralyzed.
But for Intrinsic Plus Hand, the whole playbook changes. The goal here is to stop that muscular tug of war. For mild cases, that might just mean a lot of passive stretching. But for more serious deformities, surgery might be needed to physically release or lengthen those super tight muscles and bring some balance back. And after that, therapy is absolutely crucial to make sure things don't tighten up again.
And all of this leads to the most important question, right? The one anyone dealing with this would ask. Is recovery actually possible? Can the hand ever get back to normal?
And the answer, as it so often is in medicine, is it really depends. With Ape Hand, you're basically in a race against time. The longer and more severely that nerve has been damaged, the harder the road to recovery is. For Intrinsic Plus Hand, the outcome is also pretty variable. It really depends on what caused that muscle imbalance to happen in the first place.
But, regardless of the specific condition or what the final outcome might be, this quote really gets to the heart of it all. The goal isn't just to fix a mechanical problem. It's about giving a person back their quality of life, their comfort, and as much of their independence as possible. Our hands are just this incredible landscape of complexity. Just telling the difference between a nerve problem like Ape Hand and a muscle problem like Intrinsic Plus Hand shows you how many thousands of things have to go right every second for them to work the way they do. It really makes you wonder, what other hidden complexities are at work inside your own hands right now?